Right now, as you are watching this, blood is flowing through your legs. But for millions of adults over 60, that flow has already started to slow, and most of them have no idea. Cold feet, tingling toes, cramps that wake you up at 2 in the morning. You have probably been told these are just part of getting older. They are not. They are warning signs. And in the next few minutes, I'm going to show you one vitamin, not magnesium, not the one you are probably already taking, that directly addresses what is happening inside your blood vessels right now. I also want to tell you something before we get into the science. I have had this conversation hundreds of times in my practice, with patients who came in frustrated, who had tried magnesium, tried compression socks, tried elevating their legs at night, and still woke up at 3 in the morning with cramps that made them gasp, who had stopped taking evening walks because their legs felt too heavy and too unreliable, who had quietly started turning down invitations because they were not sure they could trust their body to get through the event. These are not small things. These symptoms, the ones most people dismiss as aging, quietly reduce the size of your life. They shrink what you feel willing to attempt, and they do it gradually enough that most people do not notice how much territory they have surrendered until they try to reclaim it. That is what today is really about. Not just a vitamin, not just a circulation tip. It is about giving you back something you may not have realized you were losing. My name is Dr. William Madison. I have spent more than 20 years working with adults over 60, and I can tell you that circulation problems in the legs are one of the most underestimated health concerns I see in my practice. Not because they are rare, they are extremely common, but because they are consistently undertreated, misattributed, and dismissed at exactly the moment when addressing them could make the most difference. Here is why this matters so much and why I want you to understand the full picture before I give you the solution. Your heart pumps blood through your entire body. Every organ, every tissue, every cell depends on that steady delivery of oxygen and nutrients. But your legs are the farthest point from your heart. They are at the end of the line. The blood that reaches your feet has traveled the longest distance, navigated the most territory, and has to fight against gravity on the return journey back up to your heart. After 60, the blood vessels that carry oxygen to your legs and feet begin to change. The walls stiffen. They lose some of the elasticity that allowed them to expand and contract with each heartbeat. Plaque, the sticky buildup of cholesterol, inflammatory cells, and cellular debris, accumulates along the inner walls of arteries. The opening through which blood flows becomes narrower, and the steady, reliable flow your legs depend on starts to diminish. Most people do not feel this happening, not at first. It begins quietly. A little numbness here, a cramp there, feet that feel cold even under a blanket. And because these symptoms come and go, because they are intermittent and mild in the beginning, most people dismiss them. They attribute them to a bad night of sleep, to sitting too long, to age. That is precisely what makes poor circulation so dangerous. The most serious health threats are never the ones that feel dramatic. They are the ones that feel ordinary. The ones that have an easy excuse. The ones that give you just enough reason to wait another week before mentioning it to anyone. I want to change that pattern today. Because the gap between early, addressable circulation decline and serious peripheral vascular disease is not inevitable. It is not a fixed biological timeline. It is a window. And what you do inside that window determines a great deal about how your legs feel and function in the years ahead. Now, before I tell you which vitamin I am talking about, I need you to understand something first. Because if you do not understand why your circulation is declining, the solution will not make sense. And I want this to make complete sense to you. So stay with me. Let me walk you through 5 signs that your leg circulation may already be compromised. And I want you to be honest with yourself as I go through these. Number 1, cold feet, especially at night. If your feet feel cold even when the rest of your body is warm, that is not a temperature regulation problem. That is a blood flow problem. Your extremities are not receiving enough warm, oxygen-rich blood to maintain their temperature. The small blood vessels nearest the skin surface are the first to receive less blood when circulation is compromised, because the body prioritizes blood delivery to vital organs. Your feet are the last in line. When flow is restricted, they show it first. If you have been sleeping with extra socks for the past few years and attributing it to getting older, I want you to consider a different possibility. Number 2, tingling or numbness in your toes or lower legs. This is your nervous system telling you that oxygen delivery has dropped below what your nerves need to function properly. Your peripheral nerves, the ones that run through your legs and feet, are exquisitely sensitive to changes in oxygen supply. When blood flow is compromised, these nerves begin sending altered signals. You experience this as tingling, pins and needles, or a partial numbness that comes and goes. Most people blame this on sitting too long or sleeping in an awkward position. Sometimes that is true. But if it happens regularly, if it wakes you from sleep or is present when you have not been sitting still, pay close attention to it. Number 3, leg cramps at night. This is the symptom that sends most people straight to the magnesium aisle. And I want to address this carefully because the magnesium conversation is one I have every week in my practice. Magnesium can help relax a cramping muscle. That is real and valid. But here is what most people are never told. If the cramp is being caused by inadequate blood flow, by oxygen deprivation in the muscle tissue, rather than by a magnesium deficit, then magnesium is treating the symptom, not the cause. The cramps will keep returning, sometimes every night, sometimes for years, while the underlying circulation problem continues to progress untreated. I have seen patients who had been taking magnesium for 2 or 3 years with only partial relief. And when we address the vascular component of their problem, the cramps resolved in a way the magnesium alone had never achieved. Number 4, skin color changes on your legs or feet. This is one that people often notice but rarely connect to circulation. If you see a pale, bluish, or slightly purple discoloration on your lower legs or feet, particularly when your legs are elevated or when you have been resting for a while, that is a visible sign that oxygenated blood is not reaching the surface tissue adequately. The red color of healthy skin comes from the hemoglobin in red blood cells circulating through the tiny capillaries beneath the surface. When circulation is compromised, that color fades or takes on a bluish quality from deoxygenated blood pooling in the tissue. This is your skin literally showing you what is happening beneath it. Number 5, heaviness or fatigue in your legs by the end of the day. That dragging feeling. The sense that your legs weigh more than they should by late afternoon or evening. The desire to sit down not because you are tired overall, but because your legs specifically feel done. This happens when blood is not circulating efficiently back up toward your heart, and fluid begins to pool in your lower extremities. The medical term is dependent edema, and even mild subclinical versions of it produce that heavy, sluggish sensation that most older adults have come to accept as normal end-of-day tiredness. If you recognized yourself in even one of those 5 signs, you are not alone. Research suggests that some degree of peripheral circulation decline affects the majority of adults over 70, and a meaningful proportion of adults in their 60s, most of whom have never had the underlying vascular issue specifically identified or addressed. And more importantly, you are not powerless. What I am about to share with you is something that most people over 60 have never been told by their doctor. And it could genuinely change the way your legs feel within weeks. Let me be clear about something important before we go further. I am not against magnesium. Magnesium is a genuinely important mineral. It supports muscle function, nerve signaling, sleep quality, blood pressure regulation, and dozens of other processes. If your doctor has recommended it, continue taking it. My point is not that magnesium is wrong. My point is that it is incomplete for this specific problem. Here's the part that changes everything when you hear it. Magnesium works on your muscles. It helps them contract and relax properly. It reduces the excitability of nerve signals that trigger cramping. That is valuable and real. But magnesium does not widen your blood vessels. It does not reduce the plaque accumulating inside your arteries. It does not improve the actual volume of oxygenated blood flowing through the vessels in your legs. It does not address the vascular wall stiffness that develops with age. And it does not trigger the biological process that allows narrowed vessels to open up and deliver more of what your muscles and nerves actually need. Think of it this way. Imagine a garden hose. Your circulation is the water pressure. Your muscles and nerves are the garden at the end of the hose. Magnesium is like softening the rubber of the hose so it is more flexible. That is genuinely helpful. But if the inside of that hose is partially clogged, if the opening has narrowed from years of buildup, the water pressure is still low. The garden is still not getting adequately watered, regardless of how flexible the hose is. What you need is something that addresses the inside of the hose, something that widens the opening and allows more water to flow through with every single heartbeat. And that is precisely what this vitamin does, through a mechanism that researchers have studied for decades, and that is as well established as anything in cardiovascular nutrition science. The vitamin I am talking about is vitamin B3, also known as niacin. And if you have never heard of it in the context of leg circulation, that is exactly the gap I want to close today. Vitamin B3 does something that very few other vitamins can do. It triggers a biological process called vasodilation. That is the medical term for your blood vessels physically widening, opening up, to allow more blood to flow through them per heartbeat. The mechanism involves the release of a molecule called prostaglandin D2 from cells in the vessel wall. This prostaglandin signals the smooth muscle surrounding your blood vessels to relax. When that smooth muscle relaxes, the vessel expands. The internal diameter increases, and the result is measurable. More oxygen-rich blood reaching your legs, your feet, your toes, the precise locations where so many of the symptoms we discussed are generated. But the vasodilation effect is only the beginning of what B3 does for leg circulation. Vitamin B3 has been shown in decades of research to support healthier cholesterol levels in a specific and uniquely valuable way. It can raise HDL, your good cholesterol, which is responsible for transporting excess cholesterol away from artery walls and back to the liver for processing. And it can help lower LDL, the bad cholesterol that contributes to the plaque buildup we discussed, as well as triglycerides, the blood fats associated with cardiovascular and peripheral vascular disease. Why does this matter specifically for your legs? Because LDL cholesterol is one of the primary contributors to the plaque deposits that narrow the arteries supplying your legs. The same plaque that reduces blood flow. The same plaque that makes your vessels stiff and unresponsive. Addressing LDL and raising HDL simultaneously means that B3 is working on the vascular environment itself, not just producing a temporary opening effect, but supporting the conditions that allow vessels to remain more open over time. This is why researchers have studied niacin for decades in the context of cardiovascular and peripheral vascular health. It works on two critical fronts simultaneously. It widens the vessel through vasodilation, and it supports the reduction of what is clogging and stiffening it through its effects on cholesterol and triglyceride metabolism. Now here's something critically important that most people over 60 do not realize. As you age, your body's ability to absorb and utilize B vitamins declines. Your digestive system becomes less efficient at extracting nutrients from food. The stomach produces less acid, which affects how efficiently certain nutrients are broken down and made available for absorption. The intestinal lining, which is responsible for absorbing nutrients into the bloodstream, becomes less effective with age. Additionally, certain medications that are extremely common among adults over 60 can further deplete your B3 levels. Some blood pressure medications, particularly certain diuretics, increase urinary excretion of B vitamins. Some diabetes medications affect how efficiently B vitamins are utilized at the cellular level. Cholesterol-lowering medications, certain acid-reducing medications, and some anti-inflammatory drugs all have documented interactions with B vitamin status that are rarely discussed when these medications are prescribed. The result of this combination, declining absorption efficiency plus medication-related depletion, is a gradual reduction in circulating B3 levels that most people are never tested for because it is not part of standard blood panels. Your B3 status is not something your doctor checks at your annual physical. It is not on the standard metabolic panel. And because B3 deficiency does not announce itself with obvious dramatic symptoms in its early stages, it creates a silent nutritional gap that widens over years. Your blood vessels gradually lose their ability to dilate properly. The smooth muscle surrounding them becomes less responsive to the signals that should make them relax and open. The flow decreases incrementally. The symptoms I described earlier begin to appear and then to worsen. Not because of aging itself as an unstoppable biological process, but because of a nutritional gap that has been quietly widening while your legs were sending signals that everyone, including your doctor, attributed to something else. I want to talk about the research behind this because I think it is important that you understand this is not a fringe idea or a wellness trend. It is established science. A landmark study examining niacin therapy in adults with peripheral vascular disease, the technical term for circulation problems in the limbs, found that patients who received therapeutic doses of niacin showed significant improvements in walking distance, leg pain at rest, and blood flow measurements compared to control groups. These were adults whose leg circulation had already declined to the point of causing significant functional limitation. The improvements were meaningful and measurable. A separate line of research, following large populations over time, has consistently found associations between adequate B3 status and better peripheral vascular health outcomes in older adults. The mechanism is well understood. The vasodilation effect, the HDL raising effect, and the LDL and triglyceride lowering effects all contribute in documented and additive ways to a vascular environment that supports better leg circulation. The Cleveland Clinic, one of the leading cardiovascular medicine institutions in the world, has published extensively on niacin therapy for vascular disease. The research is not new, it is decades old. What is new is how rarely this information makes it into the conversation that older adults have with their primary care physicians about leg symptoms. Now let me talk about something I think is equally important as the vitamin itself, and that is the role that chronic low-level inflammation plays in circulation decline after 60. Inflammation in the blood vessel wall is one of the primary drivers of the plaque formation and vascular stiffening we have been discussing. When the inner lining of your arteries, the endothelium, becomes inflamed, it loses some of its protective non-stick quality. White blood cells begin to accumulate in the vessel wall. LDL cholesterol oxidizes and becomes trapped in that accumulated cellular debris. The plaque grows. The vessel stiffens. The opening narrows. Vitamin B3 has anti-inflammatory properties at the vascular level that operate independently of its effects on cholesterol. It helps reduce oxidative stress in the vessel wall, the kind of cellular damage that initiates and sustains the inflammatory process. This is a third mechanism by which B3 supports better circulation, separate from vasodilation and separate from cholesterol management. When you add all three mechanisms together, vasodilation, cholesterol improvement, and vascular anti-inflammation, you begin to understand why niacin has such a well-established track record in peripheral vascular research, and why it is particularly relevant for the population of adults over 60 who are experiencing exactly the symptoms we discussed today. If you are finding this information valuable, if this is changing the way you think about circulation and what is actually driving the symptoms in your legs, I want to ask you to do something. Share this video with one person you care about who is over 60. A spouse, a sibling, a friend who has mentioned their legs feel heavy or their feet are always cold. Knowledge that travels helps everyone it reaches. And if you have not yet subscribed to this channel, I would welcome you. We focus on science-backed guidance for adults who want to protect their health as they age, and we try to have the conversations that standard medical appointments rarely have time for. Now let us get to the practical part. How do you increase your vitamin B3 levels safely and effectively? The good news is that vitamin B3 is found in foods that many of you already have in your kitchen. You may be closer to adequate intake than you think, or you may discover that your current diet is leaving a significant gap. Let me walk you through the best sources. Chicken breast is one of the richest dietary sources of B3. A single serving of cooked chicken breast provides well over 100% of the daily adult requirement for niacin. If you eat chicken regularly, you are already getting a meaningful B3 contribution. The key is that it is cooked chicken, not processed chicken products, which often have lower nutritional value and higher sodium content. Tuna and salmon are excellent sources, with the added benefit of omega-3 fatty acids that independently support cardiovascular and peripheral vascular health. Wild-caught varieties tend to have higher nutrient density than farmed options. A serving of tuna 2 to 3 times per week contributes significantly to B3 intake, while simultaneously providing the anti-inflammatory omega-3 benefit for the vascular wall. Turkey is another outstanding source. If you eat poultry of any kind regularly, you are likely getting meaningful amounts of B3 from your diet already. The dark meat of turkey, the thigh and leg, contains more B3 per serving than the breast, which surprises many people who have switched entirely to white meat for health reasons. Peanuts and peanut butter are among the best plant-based sources of B3. A small handful of unsalted peanuts provides a significant B3 contribution, along with healthy monounsaturated fats, magnesium, and resveratrol, a compound with its own cardiovascular benefits. Natural peanut butter with no added sugar provides similar nutritional value in a form that many older adults find easier to incorporate daily. Mushrooms, particularly portobello and cremini varieties, are a surprisingly rich plant-based source of niacin. They are also one of the few non-animal sources of vitamin D and provide ergothioneine, an antioxidant with documented anti-inflammatory properties. For adults who prefer plant-based options or who are reducing meat consumption, mushrooms are one of the most nutritionally valuable additions to the diet for vascular health. Brown rice, whole wheat products, green peas, fortified cereals, and avocados all contribute meaningful B3 to the diet as well, though in smaller amounts than the primary sources I described. The cumulative effect of consistent consumption across multiple food sources adds up more than most people expect. Now, a word about supplementation, because this is where the conversation requires care. Some people ask whether they should take a niacin supplement. My answer is always the same. Talk to your doctor first. Here is why that guidance is genuinely important and not just a legal disclaimer. Niacin in supplement form, particularly at higher doses, causes what is known as the niacin flush. This is a temporary sensation of warmth, redness, and tingling primarily on the face, neck, and chest that occurs within 15 to 30 minutes of taking immediate-release niacin. It happens because the vasodilation effect we discussed is occurring rapidly throughout your surface capillaries simultaneously. It is not dangerous in healthy individuals, but it can be alarming and uncomfortable if you are not expecting it. The intensity typically decreases significantly after the first week or two of consistent use, as the body adapts. There are flush-free formulations of niacin, called inositol hexanicotinate, that do not produce the flush response. However, the research on whether flush-free niacin produces the same vascular benefits as immediate-release niacin is genuinely mixed, and some researchers argue that the flush itself is part of the therapeutic mechanism. This is a nuanced area where the guidance of a knowledgeable physician is more valuable than any general recommendation I can make. More importantly, niacin in supplement form at therapeutic doses can interact with certain medications. Blood thinners can be affected by higher dose niacin supplementation. Diabetes medications, because niacin can affect blood sugar regulation, require monitoring when niacin doses are increased. Some cholesterol-lowering medications, specifically statins, have a documented interaction with high-dose niacin that requires medical supervision. And if you have a history of liver disease, gout, or peptic ulcer disease, niacin supplementation requires specific medical guidance. None of this means supplementation is inappropriate for you. It means it is a conversation to have with your doctor with the information I have given you today in hand. Start that conversation. Bring this information. Ask specifically about your B3 status and whether supplementation is appropriate given your medication list and health history. My primary recommendation for most adults is to start with food. Increase your intake of B3-rich foods consistently over the next 4 to 6 weeks. Track how your legs feel. Notice whether the morning cramps become less frequent, whether your feet feel warmer at night, whether that heavy afternoon fatigue in your legs begins to lift. Food form B3 does not produce the flush, does not interact with medications at the levels found in food, and is safe to increase without a doctor's supervision for the vast majority of adults. Here is what I want you to take away from today. If you increase your vitamin B3 intake consistently, whether through food or through guided supplementation with your doctor's involvement, many people begin to notice changes within 2 to 4 weeks. Warmer feet at night. Fewer or less severe nighttime cramps. Less of that heavy, tired feeling in the legs by evening. Improved comfort during walks and daily activities that you may have quietly started avoiding because of how your legs felt during and after them. These are not dramatic overnight transformations. They are gradual, steady, the kind of changes that compound over weeks and months into a meaningfully different daily experience. The way real healing works in the body, not as a sudden event, but as a direction that becomes increasingly clear over time. And I want to remind you of something as we close today. The symptoms we talked about, the cold feet, the cramps, the numbness, the heaviness, they are not sentences. They are signals. Your body is telling you what it needs, and now you know how to listen. Poor circulation in the legs is not something you have to accept as inevitable. It is not just aging. It is a condition with identifiable causes, including identifiable nutritional components, and in many cases it has genuinely addressable solutions. Small, consistent daily nutrition changes, the kind that fit into your existing routine without dramatic overhaul, can lead to meaningful improvements in how your legs feel, how far and how comfortably you walk, and how fully you participate in the activities and relationships that make life worth protecting. Your legs have carried you through every decade of your life, through every job, every family event, every morning walk, every moment of standing up when it mattered. They deserve your attention now. Not because aging is a problem to be solved, but because the years ahead deserve to be lived in a body that is as capable and comfortable as it can be. If this video gave you something you did not know before, share it. Share it with someone whose legs are aching, whose feet are cold, who has been told it is just part of getting older. Because it does not have to be. I'm Dr. William Madison. Take care of yourself, take care of the people around you, and I will see you in the next video.